This is a small city called Balatonfüred, also called Hungarian Toscana, because it is a sunny region with good and sometimes world famous vineyards and vines. So we have many tourists during the holiday season who just came for swimming, sailing, or hiking in the hills.
And what have you been up to until now? So after your graduation, what did you do, and what did you do as a doctor?
So I graduated more than 20 years ago, and I started at University Hospital in the second biggest city in Hungary, so called Debrecen, and I spent there 17 years. And my last 7 years was at the Department of Pediatric Hematology and Oncology, and then I changed to this pediatric general practitioner ambulance, and I started the work here 5 years ago.
Mhm. And how many patients do belong to you as a pediatric?
It is a changes month by month, but it is somehow between 600 and 700.
Mhm, mhm. And how did you implement needle-free injection system, and how do the parents know about that you work with needle-free?
So the first newsletter arrived nearly a year ago, and when it was available, I ordered it. We have a closed Facebook group where I usually put on the news, and I also made a poll to check are the parents and the children are interested in this new method of giving vaccines.
And after you posted this on Facebook that it is available, then what was the reaction?
Surprisingly, more parents wrote that they would use it, and there are more and more parents and children who like it, and because it is not so common, and in my county there are only two places where it is available. So I had patients who came here from more than 100 kilometers, so it is not bad.
So you were famous about injecting needle-free.
Not me, but the method. I think most of them never heard about me, but avoiding a needle, avoiding inserting a needle in their bodies is a calling message, I think, so many patients and parents.
Uh-huh, uh-huh. Uh, how do you use the needle-free injection system in your practice, and what was the reaction of the children uh, in your practice?
It's a relatively new intervention, a new method, and the videos and the use of this device is not available in TV, for example, TV advertisements. So in most cases, show we have a small phantom sponge-like something that I can show them how it works, and I can show this syringe to the kids that it is not hurt and it's totally painless, mainly it's senseless itself, and I can show previously recorded videos. How does it work? And it helps to decrease their anxiety for this procedure.
And out of about 200 injections you have done, how many good and how many bad uh, results or feedback have you until now?
So of course it is not evidence my practice, but in my practice there was only one patient who said that he would use the vaccination with needles, and it also happened that we had a patient who just moved to our district from a different part of Hungary, and I said, yes, I know I had this before, and I don't like. The next time I wanna with the needles because it's nothing special. Okay, I didn't tell anything about this, and the next time when he came for the next vaccination, he came with the adapters. So you never know. So maybe something magic is in this.
Uh-huh, uh-huh. Great. What would you tell to to give information now to other parents or even adults or kids why to choose needle free?
The first and most important is to be open. So when something new, we should know if it is good for us. So it is not only that it is needleless, it it can also decrease the local reactions, and it helps the kids to decrease their anxiety. So altogether, it can establish a better patient, parent, and doctor relationship in the future.
Mhm. Why is this important for you, the doctor and patient relationship?
Because in most cases, the same doctor follows the patient from birth to the death, and it can be nowadays 80 or 90 years. And if this is hurt in the first years, this working together won't be effective. And it is not, of course, it is a bad ask for doctors because it's not good to work with somebody when we don't trust each other. But the worst thing that we can't help in some medical issues, especially in chronic ones, because we need trust that the patient comes to us with trust that we try to, and this means that we not only emphasize that it is good for your health, but with these with this attitude, we also try to decrease the unpleasant things that can happen during medical interventions or treatment.
Mhm.
And I think this establishing this long time working together is even more important that this short procedure is painless.
Mhm. Mhm. Can you just explain the children they come to you or they used to come to you and get vaccinated and what their reaction is even when they enter the street?
The best reaction that it is more and more common that after the vaccination, the kids say that I won't be afraid of next time, and this is the best reaction.
Mhm. Mhm.
And of course, they may enter our street.
But then before, how was it before?
Before we have some patient who are afraid in just entering our street, and we have a market here when they get candies, but their anxiety of this treatment or intervention is higher
Mhm. Mhm.
than the inviting of candies.
Yeah, thank you very much.
Pleasure.